Okay. Hi, Jennifer.
Hi, nice to meet you.
My name's Caitlin. I'm going to be your student clinical exercise physiologist today. How's your day going so far?
Good, how's yours?
Good, good. Thanks for asking. So before we get started today with your screening process, I just have a few forms that I kind of want to start off with off the bat to kind of get them out of the way.
Okay, sounds good.
So first off, let's start with, this is just a form that shows off just some of the general risks, and then there's a little portion on the front here that also shows the benefits of being in the Cure Clinic. I'm going to do everything in my everything possible to make sure that this goes as planned, and that I can do everything to keep you safe. We're just kind of covering all of our bases here. So if you could print your name at the top for me and then turn it over and sign.
Okay. Yeah.
Okay, and then flip it over for me. Yep, and then if you can sign right here and then date. Perfect, thank you. And then I'm just gonna sign as the witness. Perfect. Okay, thank you. And then our next one is going to be the release of liability on the front. So just, all these fun paperworks, just making sure that we can get this signed. You can print at the top, and then as well sign, print, and date at the bottom.
Okay, sounds good.
Perfect, thank you. And then on the other side of this is just another one of those risk sheets. So this just kind of shows you some of the more specific risks. And as I said before, I'm going to do everything in my power to make sure that these don't happen. But we're just trying to make sure that we are both aware of everything that will go on. So again, if you can put your name here and then initial next to all of these just to show that you agree. And then again, sign, print, and date for me.
Okay, sounds good.
Perfect, okay, thank you. I'm just gonna go ahead and do the witness signature right now. Okay, and then the other side. Do you have any questions with these forms?
No, looks pretty straightforward.
Perfect. Awesome. Okay, so now that we got all of that out of the way, I'm going to start off by just asking you some basic questions about your health, and then we can kind of go from there, okay? So just let me know if you don't understand a question, or if there's anything else you'd like to add.
No, sounds good.
Okay, so I'm going to be using what's called the PARQ Plus form. It's just kind of a generalized questionnaire that we use to kind of get some of that background history for you, and just anything that you think that would be beneficial for me to know, just so that I can make sure that I have all the information to make sure that your treatment goes well.
Okay, sounds good.
So we'll start off strong here. Has your doctor ever told you that you have had a heart condition or high blood pressure?
Yes, they have.
Okay, perfect. Do you ever feel any pain in your chest during activities, like physical exercise, or maybe just putting some groceries away, or even when you're at rest?
No.
Perfect. Okay, have you ever lost balance because you became dizzy or lost consciousness, especially within the last 12 months?
Nope.
Perfect. Have you ever been diagnosed with another condition, a chronic medical condition, other than heart disease or high blood pressure?
No.
Okay, perfect. Let's see. Are you prescribed any medications for a chronic medical condition?
Yes, I am. Here is my medication list, actually.
Oh, perfect. Thank you. That will be very helpful. So it looks like you are on atenolol, correct?
Yes.
Okay, perfect. Okay. Do you currently have, or especially within the last 12 months, any bone, joint, or soft tissue injuries such as like muscles, ligaments, tendons, that you think could be made worse by physical exercise?
Yes, I have right knee pain and chronic lower back pain.
Okay. Is there any time that that gets better or worse, or is there anything that you specifically know that makes your knee or back hurt more?
I work at a restaurant, so I'm on my feet a lot. It's just long days really hurt it.
Okay, so just like after a while of
Yeah,
being
after
pretty active?
Yeah, after a long time being on my feet.
Okay. And then when I make that exercise prescription for you, we can kind of go through some things, and if you find that there's something that you specifically causes you some more pain that you're not used to, we can always switch it up, because the point is to get you feeling better. We don't want to let you leave here in pain.
Sounds good.
Okay. Has your doctor ever said that you should be doing like medical supervised physical activity?
Not specifically medically supervised, but she tells me that I should exercise more often.
Okay, sounds good. Perfect.
That's
Okay.
why I'm here.
Okay, no problem. I'm going to flip over to the back sheet, and we're just going to go through some more questions that are going to ask you about specific conditions that you may have. Okay? Do you have osteoarthritis, osteoporosis, or any back problems?
Yeah, lower back problem.
Okay.
Lower back pain.
Perfect. You don't take any sort of like medication or anything for your back pain?
No.
Do you have any problems controlling that pain?
No.
Okay. Perfect. Do you have any joints causing pain or like a recent fracture caused by osteoporosis or cancer? Different things like that?
No.
Okay, sounds good. And then have you ever had a steroid injection or steroid tablets for your pain?
No.
Okay. Perfect. Do you have cancer?
No, I do not have cancer. I hope not.
Me too. Okay, perfect. Let's see. Do you have a heart or cardiovascular condition? Something similar to like coronary artery disease, heart failure, a diagnosed abnormality or arrhythmia for your heart?
No.
No? Okay.
Just the high blood pressure.
Gotcha. Okay, yeah. Actually, funny you should say that. That's what we're going to cover next. So do you have difficulty controlling your condition?
No.
No? Okay. So that medication helps with your blood pressure?
Yeah.
Perfect. Okay. Do you know what your resting blood pressure is?
No.
Okay. That's okay. Perfect. Do you have any sort of thing like type 1 or type 2 diabetes, or are you pre-diabetic that anyone's ever told you?
No.
No? Okay. Perfect. Okay, we're almost done. I know there's so many questions here. We're on our last sheet of them.
Sounds good.
Okay, do you have any sort of like mental health problems or learning difficulties?
Yeah, I have anxiety. I take medication for that.
Okay.
I take that in the night, in the late evening, afternoon.
Okay, sounds good. Let's see. Do you feel like you have any difficulty controlling that condition while on your medication?
No, the medication seems to be working.
Perfect. And then, do you have Down syndrome and back problems affecting nerves or muscles?
No.
Okay, perfect. Do you have any sort of respiratory disease like COPD, asthma, pulmonary high blood pressure?
Nope.
Okay, perfect. Have you ever had a spinal cord injury?
No.
Okay. Have you ever had a stroke?
I have not.
Okay. And then lastly, are there any other medical conditions that you think that I should be aware of, or that you think that we missed in this load of questions?
No, it looks good.
Okay, perfect. So based off of the results of some of the questions that you asked, it is recommended that we kind of chat with your doctor. So if you don't mind, what I'm going to do is I have this sheet that I'm going to send to your doctor. With your permission, it just kind of is going to give them your name and have them kind of give me some things that they think that you would benefit from, and then just different things that we need to be aware of. Does that sound all right with you?
Yeah, sounds good.
Perfect. So I'll get this sent over to your doctor, and then he can send over just some more information so that we make sure that everyone's on the same page with this. Okay, so then I would like you to just quickly read over this and tell me if there's anything that you think I missed. And then if not, on that back page, I'd like you to sign it for me.
Where do I sign?
On the back. Well, all the way in the back. So we have to go through, this page and this page of questions.
Right.
Just make sure I didn't miss anything or that I marked everything correctly. Okay, perfect. Yep, and then if you could just print your name here and then sign here and date.
Sounds good. And then...
Yep. Oh, and that's fine. Yep, thank you.
There you go.
Okay, I'm just gonna do this witness signature. Okay, perfect. So I just want to quickly confirm just your contact information that I have that correctly in case I need to get a hold of you.
Okay.
Are you still at 894 Carrington Place in New Berlin, Wisconsin?
Yep.
Perfect. And then a good phone number for you is 262-975-8539?
Yep.
Perfect. And your primary care provider, is Dr. Robert Bobby?
Yep.
Okay. And your husband, Tony, is the emergency contact, correct?
Yep.
Okay, perfect. So now that we finished that Part Q Plus and that I can go ahead and contact your doctor, I just have a few other questions that I would like to talk about with you.
Sounds good.
Okay, so what, I know you said that your doctor recommended that you get some exercise. What are some of, what do you currently do for exercise?
Not a whole lot, but my job is very active. I don't really have a regular exercise schedule or...
Okay.
Don't really do anything.
That's okay. Okay, so have you done any structured exercise or anything in the past that you remember?
I have not.
Okay, perfect. So I'm glad that you came to see me. Then we can kind of get some structured exercise into your day. When it comes to your goals, what is one of the biggest things that you want to get out of our time together in the 6 weeks that we're here?
My goals are really just to maintain weight, feel stronger, and decrease fatigue at the end of my workday.
Okay, is there anything that you specifically want to start with?
Probably to reduce fatigue at the end of my workday.
Okay. So when you say reduce fatigue, do you mean what do you mean by that? Can you just give me something that you would like to see different in your life?
I come home very tired usually most of the days and worn out. I just like to not feel so worn out and tired even on my days off.
Okay.
Just kind of have enough energy.
Perfect.
Boost my energy.
Okay. So with that fatigue, is there is it just physically your body feels drained?
It's
or
physically and mentally.
Okay. Sounds good. So, and then what did you say your hours were again?
I work late afternoons and nights, but during the day I'm meeting with a bunch of other people and making schedules and meeting with other restaurant managers.
Okay, sounds good.
So, pretty busy days.
Is there any time that you have in those mornings that you'd be able to kind of at least take maybe an hour out for yourself?
Yes, yeah, I could move some stuff around and get an hour or so in the morning.
Okay. Is that something that you would feel comfortably doing pretty consistently just to kind of attempt to make some of those changes in your life?
Yes, yeah, that would be something I'd feel comfortable doing regularly.
Okay, perfect. Yeah, so then we can kind of make some time for us to meet and work on your structured exercise. And then as we spend more time together, we can talk about just how to decrease some of that fatigue and different things like that. Hopefully by the end you'll have a little bit more energy because you're used to kind of working out with me, and then we can get that energy up and just hopefully you won't feel as drained by the end of the day.
That sounds good.
Okay,
Yeah.
sounds good. And then maybe is there like a long-term goal that you would like to start with me? And then I can give you the tools to continue on with?
Probably to maintain weight and feel stronger,
Okay.
just overall.
Gotcha. And then when you say like feel stronger, do you have issues picking up like boxes and things, or do you just kind of want to
Just in general, just feel stronger and get some of my pain away and
Okay.
get stronger and live every day better.
Okay, that sounds great. And then also when it comes to maintaining your weight, are you is that something you want to stay within those, your weight range? Is there a range that you would like to stay within? Is there a 5-10 range, or do you want to stick exactly to that number that you have?
Within the 5-10 range. I would like to stay around my weight that I'm at now and
Okay,
maintain.
So you definitely don't want to gain weight. If you were to maybe lose some weight, if that just was a byproduct of, that's okay with you?
Yeah.
Okay, perfect. We can spend some time, and then with feeling stronger, I can make sure to incorporate just some additional resistance training exercises, and we can make those exercises pretty comparable to your activities of daily living. So, I don't know, maybe lifting a case of wine off the ground to bring to some of your staff, or helping out with different things like that. Does that sound like something that would be okay?
Yeah, it sounds perfect.
Awesome. Okay, so are there any other questions that you have for me that I can answer right now?
No, it sounds good.
Okay.
No, looks good. I'm excited to get started.
Perfect. Sounds good. So it was a pleasure to meet you, and I can't wait to see you at our next session.
Yeah, it was a pleasure meeting you.
Have a great day.
You too.
Okay, hi Jennifer. My name is Caitlin. I'll be your student clinical exercise physiologist today. We are going to start off with just some basic screening questions so I can get some information about you, your lifestyle, and your health. But before we start to get into all of that stuff, I'm going to start with some just basic liability and risk forms, if you don't mind. So this first one is just down here. It shows you the benefits of being a part of our CURE program, and then up here it does show some of the inherent risks. We just kind of want to make sure that you're fully aware, and I'm fully aware, and then I will also do everything in my power to make sure that none of these risks actually happen, but we just want to cover all of our bases. So if you're okay with that, then I would like to have you sign and date down here for me, please.
Okay.
Perfect.
There you go.
Thank you. And then I'm going to do the witness signature. Okay, perfect. So our next form here is just a basic release of liability for the clinic and the university. So feel free, and as well as our program, I'm sorry. And so feel free to read through this, and then when you're ready, I'm going to have you sign, print, and date down here.
Okay, sounds good. And then...
Yep.
There you
Awesome.
go.
Thank you. And I'm going to do the witness signature again on this one. Okay, awesome. And then just our final form, I'm going to go through just some of the more specific risks with you. This is very similar to that first form that we signed, but I just want to kind of make sure that, again, you're fully aware and I'm fully aware. So you can read each risk and then initial next to it, sign, date, and print at the bottom for me.
Okay, sounds good. There
Perfect.
you go.
Thank you. Okay, so now that we have all of those fun forms out of the way, I'm just going to start off by asking you just a few questions based off of your medical history and just some of the things that may be going on in your life. So what I'm going to be doing is I'm going to be using what's called the PARQ Plus. It is they call it a physical activity readiness questionnaire. So basically, we use this just to kind of determine the different things that we need to watch out for, or potentially talk to your doctor before we start with any sort of exercise. How does it sound?
Sounds good.
Okay, perfect. So for the first question, has your doctor ever said that you have had a heart condition or high blood pressure?
Yes.
Okay.
I take medication for it.
Okay, sounds good. And I got that medication list from you earlier, so I can take a look at that. Do you feel any pain in your chest at rest or during your daily activities of living or even when you exercise?
Nope.
Perfect. Okay. Have you ever lost balance because of dizziness or lost consciousness?
Nope.
Okay. Have you ever been diagnosed with an additional chronic medical condition besides heart disease or cardiovascular disease?
Nope.
Okay, perfect. Are you currently taking any medications for a chronic condition?
No, just the high blood pressure medication.
Okay. Do you currently have any sort of bone, joint, or soft tissue, such as like a muscle, ligament, tendon, sort of injury that could be made worse by being physically active?
I do have chronic back pain and right knee pain.
Okay. Sounds good. And then has your doctor ever said that you should only do medically supervised activity?
Not medically, but just to get more exercise in my daily life.
Okay,
So
sounds
that's why I'm here.
Well, we're glad to have you. Okay, since we figured out and finished all of your medical history and different things like that, I would like to sit down and talk to you about some of your goals here in our program. How does that sound?
Sounds good.
Okay, perfect. So what is like the main reason that you are coming to start a structured exercise program?
One of my main goals is to decrease fatigue in my daily life.
Okay. And then what specifically, is there something specific in your life that you're looking to see that change in?
Just in everyday life, just to feel stronger and just go throughout my days.
Okay, so you also want to feel stronger?
Yep.
Okay. So then just back to that decreased fatigue. So is it when you wake up in the morning? Is it when you get home from work during the middle of the day?
So I work very long hours at the restaurant. I would just like to decrease my fatigue when I get home and even my days off so I don't feel as tired.
Okay, sounds good. What kind of hours are you working?
I work the late evenings to nights, so like middle afternoon to night.
Okay, and then what are you doing in that morning time?
That morning I'm meeting with clients and other restaurant managers and making schedules.
Okay, so if we just sit down and kind of talk about this, first goal is decreasing fatigue. When it comes to those morning times, would it be possible for you to maybe take 2 days out of there to do something for yourself or just kind of relax and then also attend our like structured exercise sessions?
It could be possible. I'm just very busy, and my husband tells me that I'm very busy. But yeah, I think I could set aside some time to do that in the morning.
Yeah, definitely. So does 2 times a week sound okay for right now?
Yeah, that sounds good.
Okay. Yeah, I definitely think that being able to take some time for yourself and work on your health will definitely help with some of that fatigue and then getting exercise and then being able to also kind of some free time so that your mind's not always thinking about work.
Yeah, that sounds good.
Okay,
yeah, I would
perfect.
like that.
Awesome. Okay, so then you said another one of your goals was to feel stronger.
Yeah.
Is it just in general, or is there any specific things that you seem to struggle with or that you want to find more ease with?
Just in general. I mean, I have to lift a bunch of stuff at the restaurant, like cases of wine and food, and I just like to feel stronger throughout my daily life and make those tasks a little easier.
Okay. We can definitely work on that. I think a good way to kind of combat that goal and check it off our list is we can incorporate just some additional resistance training exercises and then working on those and making them quite similar to what you would be doing in your daily life at your restaurant. Does that sound like something that you would agree with?
Yeah, that does.
Okay, perfect. Is there any other goal that you would like to think about while we're together?
Yeah, I'd like to maintain my weight if possible.
Okay.
Like within the 5 to 10 pound range, if that's possible.
Most definitely we can work with that. So when it comes to starting an exercise program, you may see some change in your weight when it comes to decreasing some of those different parts of adipose fat, or when you start strength training more, your muscle weighs a little bit more than that fat, so you may put on some additional weight and then just kind of working on turning some of that muscle into lean muscle and just kind of making those changes.
Okay.
So just so that you're aware that might happen, but yeah, I definitely think that we can keep you around that weight if that's something that is it because of any specific reason?
No, I just would like to stay around that weight.
Okay, you just feel best?
Yeah, I feel best at this weight.
Okay, yeah, sounds good.
I'm happy the way that I look right now, so.
Okay, definitely. We can make a change with that. Is there any other goals or anything that you want to work on?
No, that's good.
Okay.
No, that's good. That's all. That's
okay,
everything.
Perfect. Well, thank you so much for meeting with me today, and I can't wait to see you at our next session.
Oh, thank you.